There's a lot of information given by a lot of different people. Any questions, let me know. It's informal, so if you gotta get up and go and do something, that's fine, just leave. Mine is on infection prevention. Some of the information that I give you is required by state, and so there's certain topics they want and certain things to talk about. So if some of this stuff comes across and you're thinking, why are you talking about tuberculosis? We don't have that problem. But it is required by state. So there's two types of infection, two classes. There's the nosocomial and there's the community acquired. Nosocomial is the one we don't want. That's when a person outside is coming into our facility with something like, say, pneumonia, and they come in, and while they're here, they had to have a Foley catheter, and they end up with a UTI. So it's something that different than what they actually are coming in with. And this is bad anymore because they're getting more and more. You have to report these things, and then that cuts down on your income big time. So community acquired is the other one. That's like you're coming in because you have pneumonia. You've acquired it out amongst everyone. We really don't want either one, but nosocomial, please. CDC estimates that 1.7 million hospital-acquired infections from all types of microorganisms and bacteria cause or contribute to 99,000 deaths a year. And so, I mean, if we could see the germs, I almost think we're better off because then we remember. And it's like, ew, gotta wash my hands, or ew, I wanna wear, protective equipment or PPE. CDC also says that hand hygiene is still the #1 way to prevent the spread of infection. Also covering your cough. Cough into your arm or your up here into your shoulder area, not like this. And I still do see people once in a while, not here, but out in the public, or they don't cover at all. And I think they'll learn it more from their kids than they will the adults. I mean, the kids, I think, are good teachers, and I think they're growing up with it now. They're getting a good sense of it from the school system. Teachers are teaching them stuff like that. So stay home if you're sick. I think everyone knows this. State requires that the form, and I think you're all familiar with the form that you get from me, if you're out ill, that when you come back that you fill it out. They require a way of tracking employees, and they do not look. I do not call state and say, oh, I had Karen bring me a paper today, she's in the book. They don't care. Their thought is, at 1 o'clock this afternoon, after 5 people ate in the cafeteria, no offense, but they go in and eat, and then 5 people at 1 o'clock are all vomiting or something. Okay, do we have bad lettuce? Did we have bad, vegetables? Whatever. And so it's our way of, is there a problem within that has to be or needs to be investigated? And so when you fill out those papers, they go in the book. When state comes, they say, how do you track your employees? I pull the book out, show them, and they flip the page and they see the years and they go, oh, okay, that's really what that's for. If you're out because of fever, you must be fever-free for 24 hours. And that doesn't mean that you've been popping the ibuprofen or the Tylenol to get fever-free. That means 24 hours fever-free without the help of Tylenol or ibuprofen. If you're sick for more than 3 consecutive days, you've had to call in, then you need to go to one of the providers and get a note to say that it's safe for you to return. Hot topic right now, a year ago was Ebola. This year it's the Zika virus. It was in our country or in the United States because of people going to the countries that had it already to visit family or whatever, and then they were coming back and exposing the other people to it. It's spread by the mosquito bite. sexual contact with someone who's positive for the virus, and also blood transfusion. It is now in the United States not being spread by people that go to other countries. It is in the United States being spread by the mosquito now. Actually, it was discovered in 1947. It's nothing new. It was harmless then, but as everything evolves, it gets worse and it gets more resistant to things. I know in Florida, when it was discovered, it has already become resistant to a lot of the insecticides, and they were having a very difficult time trying to get rid of the mosquitoes or kill the pools of mosquitoes. And you know, they always say about the water, no standing water, you know, get rid of your buckets, empty your water. Well, I always thought it must take like a bucket of water that you're supposed to dump. They lay eggs in like a leaf that has rainwater or water in it. They'll go and lay and reproduce in just water in a leaf. And so they're quite resilient. The signs and symptoms are like everything else: fever, rash, joint pain. A lot of times you don't know you have it if you have it. The main thing with the Zika virus is the pregnant women. If the pregnant women get it while they're pregnant, then the babies are born and they have very severe brain defects. I mean, bad brain defects. They can't be on their own. There are, and this I got like a couple weeks ago, there are 878 reported pregnant cases in the United States, and there's already been 23 live-born infants with the birth defects. And they've really been going and asking Congress for aid in trying to get rid of the mosquito or to kill the mosquito, and the other one because one of these children, and depending on how long they live, they can be up to like, it costs like $10 million per child because of all the services that they require. And so it's going to be a huge financial issue also. Influenza last year, we had 3 positive cases. One was hospitalized. Of the 3, 2 had not been immunized, 1 had. Last year, all but 3 employees were immunized. Tammy is given the flu shots this year. CDC said, which this is November the 7th, CDC says by the end of October, so the time is now. And it takes 2 weeks after you receive the vaccine for it to actually be fully effective. CDC, I get email from them weekly on the flu, and there has not been any cases in Nebraska yet. But now I can't remember. It's a little island area straight down from us, and they're like full blown with the flu. So it won't be long, I'm sure.
Kathy?
Yes?
It is also policy about
Yes.
vaccinating.
Do you want to mention that?
And so if we don't, as soon as we have a positive case, those who did not get the vaccination will have to mask. That is our policy. So.
TB. Luckily, it's not prevalent in this area. There's 2 types of TB. It's the latent, in which it's in the body but it doesn't spread, and active in the body and it does spread. Nebraska's had a total of 33 cases reported in 2015, and most of them, or the greater percent of them, was in Douglas County, which is clear down east, kind of like next to Iowa, in there, in that area, yes. And if we ever suspect a case, we do have the negative air pressure room, which is the scope room. That room has a key, and the key can be turned and it can become a negative air pressure. Also, we have 2 machines downstairs that are portable that can be brought up And you can take them to like one of our clinic or patient rooms and put them in the window, and that room will become a negative air pressure room also. But let me tell you, if we have something like that, it'll be going to Kearney, or it'll be going to Lincoln, or to a facility that's equipped to handle that. Bloodborne pathogens, OSHA's definition, they're disease-causing microorganisms found in human blood as well as human blood components and products, saliva, tissue, vaginal secretions, semen, anything that contains the blood. The three major viruses are HIV, hepatitis B, hepatitis C. The greatest one for ours usually is the hepatitis B for healthcare. Transmission, you get them through contaminated sharps or needle sticks, non-intact skin, cuts, scratches, or mucous membranes in your mouth, your eyes, your nose. Protect yourself using the standard precautions. Choose PPE accordingly. And you know, we have the isolation cart, which is available, and it is taken down the patient hall when we have someone in contact isolation. But you can have a patient down there that say droplet precautions. But anybody that has a cough handles it different ways. I mean, and some people have more sputum than others, so they're down there hacking, they're not covering their cough. You're gonna put a mask on to go into that patient, but you know, if they're not covering their cough and they've got a lot of sputum and they're spewing, please bring the isolation card out and use whatever you want to use. I mean, in addition to what's required. It's not only the patients that we're trying to protect. I mean, I don't want you guys getting something. I don't want you getting something, going home and giving it to your kids or your significant other or anyone. So it's just as important you guys protect yourself as it is as we protect the other patients. And I'm really proud because when I took over infection prevention, and Jennifer had it before me, there had only been one hospital-acquired infection, and it was due to a patient that had been here for many, many, many years. And he got pneumonia, and she investigated it, and it wasn't us from within as to the way he got it. It was someone that visited him a lot, ended up being the one. So I'm thinking of all the years, I mean, you guys did a wonderful job. And I think you do a wonderful job anyway with your hand hygiene and with trying to keep things clean. Last year we did a test on the keyboard where you clock in at, and Karen came and she swabbed it and took it into lab and grew it out. It grew nothing. I was expecting a whole, I mean like 10 different bacteria, you know, and there was nothing grew. And so I thought awesome to all of you guys, because that's wonderful. I thought I picked the dirtiest thing ever, and it turned out really well. So back to the bloodborne pathogens. We do have spill kits, and they're located in the dirty workroom, lab, bottom of the basement stairs, and they're not all the same. They're each specific to that specific area. The eye wash stations, we have the dirty workroom, 2 in the clinic, 2 in the kitchen, pharmacy, lab, and I know we are getting one in ER. Is it there now? Good, good. Wendy suggests, and she would like anybody or anytime throughout the day and there's a blood spill. I mean, like there's blood on an exam table, or there's blood on the floor, or something like that, to please let her know immediately. Don't leave her a note like at the end of a clinic or end of whatever, your shift. Tell her immediately so it can be taken care of. Video. This is a video on just doning and doffing. It's not intense like if you were doning and doffing for Ebola, but it kind of gives you the steps. as a reminder. And also on the isolation card, there's a little card that gives the steps. So if you're going into a room or something, it's a reminder.
Kathy, would you hit the lights and I can get it recorded better? Thank you.
Against infections.
What-
Personal
sorry.
protective equipment
this.
acts as a barrier to prevent or limit contamination of skin, mucous membranes, or clothing of staff in order to prevent transmission of potential infectious agents.
Did that help?
The sequence
No,
for
it's
donning
good with it.
personal protective
It's
equipment
okay.
is designed to prevent and control transmission of microorganisms in the healthcare setting. The steps are: 1. Perform hand hygiene. 2. Gown. 3. Mask. 4. Eye protection. 5. Gloves. Hand hygiene is considered the most important and effective infection prevention and control measure to prevent the spread of infections. Before donning your personal protective equipment, wash your hands. Step 1. Wet your hands with warm water. 2. Apply soap to produce lather. 3. Rub hands together for 10 to 20 seconds. 4. Rinse. 5. Dry your hands with a paper towel. And 6. Turn off the tap with a paper towel. If you're using an alcohol-based hand sanitizing product, ensure it contains an alcohol concentration of 70 to 90%. The gown is to fully cover your torso from neck to knees, shoulders to wrists. Wrap it around the back and secure it with ties at the neck and at the waist. If the gown is too small, use 2. First ties in front, the second in back. There are various kinds of masks and respirators, but each is worn in a similar fashion. Medical face masks are loose-fitting and are designed to filter some of the wearer's exhaled organisms to reduce exposure to others. Respirators are tight-fitting and require certification from the National Institute for Occupational Safety and Health. They are designed to filter inhaled organisms to reduce exposure to the wearer. For respirators, be sure to use an appropriate size mask as determined by approved fit testing. With clean hands cupping the outside of the mask, place the mask over your nose, mouth, and chin, securing it to your head with ear loops, ties, or with the elastic straps to ensure a snug, secure fit. Place the upper head strap around the back of the head above the ears. Place the lower head strap around the back of the neck below the ears. Do not cross the straps. Position the flexible nose piece over the bridge of your nose, shaping it to fit. Adjust the mask so it is snug to your face and extends below your chin. For respirators, perform a seal check. Position eyewear over your eyes and secure to your head using the earpieces. If you wear eyeglasses, put them on first, then don your eye protection. If required, the face shield should fit over the brow. Gloves go on last. Insert your hands into the gloves and extend the gloves to cover the cuffs of your gown. Keep your gloved hands away from your face. Avoid touching or adjusting other personal protective equipment. Limit surfaces and items touched. Remove gloves if they're torn. Always perform hand hygiene before putting on new gloves. All personal protective equipment must be removed in sequence and discarded carefully. Proper removal is important since equipment is now contaminated. The steps are: 1. Glove removal. 2. Gown removal. 3. Perform hand hygiene. 4. Eye protection removal. 5. Mask removal. And 6. Perform hand hygiene. The outside of the glove is dirty and must be removed with care. Grasp the outside edge of the glove at the inside of the wrist and peel away, turning the glove inside out. Hold it in the opposite gloved hand and slip a finger under the wrist of the remaining glove. Peel off from the inside, creating a bag for both gloves. Discard immediately into the waste receptacle. The gown front and sleeves are dirty, so it must be handled from the back and inside. Starting at the neck, unfasten the ties. Peel the gown in a forward or downward movement and away from the neck and shoulder, turning it inside out. Fold or roll into a bundle and discard. Perform hand hygiene before proceeding. The outside of the eyepiece is contaminated, so handle eyewear by the earpieces. Pull away from your face and place into a designated receptacle for cleaning. Personally owned